So while we were on break, I was asked these very questions out in the hallway. Well, what if I have postmenopausal symptoms? What can I do to manage these postmenopausal symptoms if I've had blood clot or I have thrombophilia? Well, estrogen and progesterone may be okay depending on the severity of the coagulation situation if you're on anticoagulation. Otherwise, we would recommend relief for specific symptoms. And that may be specific therapy for those symptoms which may include mood changes, hot flashes, or hot flushes as they're called across the ocean, vaginal dryness, or sleeplessness. Now, for mood changes, and these may affect men during menopause too, counseling and support. And then the category of antidepressants called selective serotonin reuptake inhibitors have been effective not only in treating mood changes, but also, as you'll see on the next slide or two, in treating hot flashes. And also the category called selective norepinephrine inhibitors, reuptake inhibitors, have also been effective. But also there are non-pharmacologic treatments like keeping the core body temperature as cool as possible, dressing in layers, using a fan. For those of us in the room who have been through this, sleep in a cool room, drink ice water, refrain from smoking, exercising regularly, practicing relaxation techniques, don't let your boss get you upset, avoid perceived hot flash triggers like hot drinks, caffeine, spicy foods, alcohol, emotional reactions, and anticipating that it usually takes about 6 months to get through the worst of it. Some people have to endure this forever, but the worst is usually about 6 months. Non-prescription remedies that some of our patients with hot flashes seek, such as soy, vitamin E, Donquai, ginseng, evening primrose oil, and red clover, have not been found to be effective. But there are studies that show that there are some non-hormonal treatments that do not increase the risk of blood clots that have been found to be significantly effective in medical studies. And they include the selective serotonin reuptake inhibitors, that's paroxetine, fluoxetine, sertraline, citalopram, and that's the Prozac family of drugs. And then the selective norepinephrine reuptake inhibitors, venlafaxine, etc. So your doctor may be able to prescribe one of these instead of estrogen or estrogen and progestin. And gabapentin, which started as a seizure medication, has also been shown to reduce hot flashes. The other big complaint is vaginal atrophy, meaning thinning in the lining of the vagina, and dryness. Lubricants are temporary measures to reduce vaginal dryness, like KY jelly, and vaginal moisturizers provide long-term relief and are like Replens, and they can be purchased over the counter in the drugstore. But we have more and more data that topical estrogen applied directly to the vagina in the form of tablets, rings, and low doses of cream have very little systemic absorption, and we're beginning to use that in select cases of women with a history of breast cancer or thrombosis to restore the lining of the vagina to its premenopausal state. And then there's the sleeplessness. So that the top there is melatonin, the middle one that is Ambien, the bottom is Sonata. These are specific medications, one's over the counter, the last two are prescription. The last two should only be used for short term, but they may be able to help in that early perimenopausal period when the sleeplessness sets in, to help make that transition through that sleepless period during menopause. And hormones could be avoided. And if that doesn't work, you can always go to Australia. I heard that several times during a couple of the early talks, and count sheep. Thank you very much for your attention. I think we have time for questions.